Hello everybody and welcome to my video on an upper limb tension test, focusing on the ulnar nerve. My name is Jody Roberts. I am a student of Indiana State University's Doctorate of Athletic Training program. Let's begin with what brought you here. If you're watching this video, you have probably already ruled out any emergent situation and your patient is showing neurological symptoms. If you have not done that at this time, I recommend going to my suggested videos at the end of this clip and viewing Megan Kinzer's full neurological exam. If you know what you're looking at and your patient is showing symptoms of some sort of ulnar nerve pattern, and or they have a history of an injury or a concurrent injury that's bringing inflammation around the ulnar nerve, then you come to the right place to see if a tension test is right for you. Here's what it's all about. To understand a tension test, you first need to understand how nerves work normally. For that, we're going to review a little bit of pertinent anatomy. Of course, you have probably taken classes on nerves and how they work, but here's a little bit of a review. So we have a nerve here. Within that nerve, you have nerve fibers, you have fascicles. It's important that you understand that our nerves, our peripheral nerves, are coming from our central nervous system. Now, all of these peripheral nerves have to cross a whole bunch of joints that are happening in here. We move our joints around a lot. Now, when we move our joints around a lot, it is important that you understand that nerves should be moving along with it and facilitating that movement, not being fixated in a certain area and stuck there as we're trying to move past certain points. That way, the nerve continues to work all the way through our range of motion. Now, this nerve fiber is moving easily within the fascicles, and the fascicles are moving easily within the epineurium. So all of that should be moving quite fluidly. Make sure to take a second to review this picture. Make sense? Excellent. Now that we've reviewed how nerves are supposed to work in your body, let's focus in on the ulnar nerve. So your ulnar nerve is a nerve that comes off of your brachial plexus. Remember that your brachial plexus is this bundle of nerves that comes right across your shoulder, just like this, and then breaks off into several other peripheral nerves. Your brachial plexus stems from C5 through T1 nerve roots. The ulnar nerve is one of those nerves that branches off of the brachial plexus. A closer look at the ulnar nerve looks like this. Now, your patient is probably complaining about loss of sensation or burning in this area. On the palmar aspect, you'll find that it is in the middle half of their hand, middle ulnar half of their hand, and extends up into their pinky and ring finger, half of their ring finger. On the dorsal side of their hand, you will find it's a similar pattern, almost half the hand, covering all of the pinky and then half of the ring finger, the ulnar half of the ring finger. So what's it mean if a person shows up with this pattern? It means that somewhere along that ulnar nerve, they have something called, possibly have something called a tensioner. AMT stands for adverse mechanical tension. Remember earlier that a nerve should move freely within its own sheath anytime that the joint makes it move. Now, when the nerve is having some sort of adhesion within the sheath, it causes a sort of tension point every time the joint attempts to move. This can create any symptoms showing up in the pattern, depending on what nerve you're discussing. Now we're talking about the ulnar nerve. We've already discovered what pattern that would look like. Those tensions are called crush or double crush, depending if they have one tension point or two tension points somewhere along that nerve. Adhesions can happen for a couple different reasons. If a person has a history of injury in areas that are really close to that nerve, all of that inflammation and buildup in your body trying to help itself can cause adhesions between the nerve itself and the sheath that it is within. So those adhesions, again, cause that mechanical stress that we're talking about. To determine this, it is important that we run a tension test. Now, second, we're going to discuss what a positive tension test means and how we determine if it is an adhesion within the nerve or if it's caused by some sort of other mechanical pressure happening outside of the nerve, such as inflammation of a current injury. In order to perform a tension test, it is important that you first depress the patient's shoulder while they're lying in a supine position. The second thing you're going to do is you're going to abduct the patient's shoulder to 90 degrees. After doing so, you're going to make sure that you externally rotate the shoulder until you feel some resistance to external rotation. At this time, you're going to ask the patient to go ahead and try to touch their thumb to their pinky finger. When they've gotten as far as they possibly can go, it is important that you instruct the patient to tilt their head away from the shoulder you are testing. Of course, after you've done all of that, it is important that you do a bilateral comparison to see if there's any difference in the range of motion between the affected side and the not affected side. If this test at any time produces symptoms, it means that this is a positive tension test and that somewhere along that line, there is some sort of tension happening on that nerve, unless, of course, you get a false positive, which we'll discuss in just a moment. Now, I want to review these action steps that we just went over and inform you that it's really neat that you can perform this same test over a telemedicine encounter. The patient can actually go through this test themselves. I'm going to demonstrate that now. So you're going to go ahead and have the patient in front of the camera in an area where they're able to move freely. Remember that they're going to have to make sure that they're sitting up straight. On the side that they're going to test, which I'm going to demonstrate on my right side here, it's important that they depress the shoulder. Then they're going to abduct their shoulder to 90 degrees, keeping that depression. You're going to ask them, are you feeling any symptoms yet? They'll say yes or no. If they do feel symptoms, it's a positive test and it's time to stop. At this time, if they feel no symptoms, you would instruct them to go to 90 degrees, touch their thumb to their pinky, externally rotate, extend the wrist. Remember, each step you're asking them if they feel any symptoms. If they still don't feel any symptoms at this time, you're going to have them laterally side bend away from the area that they're working on. Now, if this produces symptoms, again, that is a positive test. If this does not produce symptoms, this would be a negative test. So now you perform the test either in person or over telemedicine. Let's discuss this positive test and what exactly that means. Now, a positive test means that a patient's symptoms are reproduced by the procedure and are changed by either adding or subtracting sensitizing maneuvers. This could mean that a patient was okay depressing their shoulder, for example, and then abducting, still didn't feel any symptoms. They were okay going into external rotation, crossing their thumb over, but as soon as they extended their wrist, they started to produce symptoms. When they make sure their wrist goes back to a neutral state, the symptoms went away. That would indicate that there is a tension somewhere along that nerve. The problem is that it doesn't always mean that there is a tension within that nerve. It could be that the nervous system is already irritated or hypersensitive. Could also mean that the nerve is being pressed into a surrounding structure regardless of an adhesion. So make sure that the person, in order to see if it's a true positive tension test, make sure that the person is performing the movements correctly. Make sure that there is no other restrictive clothing or barriers that are going to inhibit the test and its accuracy. If you have screened their history and made sure that they don't have any other chronic pain that they're dealing with or any mental health illnesses that they are working through that cause some sort of hypersensitivity to the nervous system, then it is likely, if you were able to reproduce symptoms, that they have a positive tension test. Thank you for listening to my video on the upper limb tension test for the ulnar nerve. I hope this illuminated what a tension test is, what it means for your patient. If you are interested in looking at other tension tests, please stay tuned for the next video that is going to be suggested to you, where I go over a tension test for the radial nerve. If you are interested in a tension test for the medial nerve, please go to my suggested videos and watch my colleague Dan Waterman discuss tension tests for the median nerve and its implications.